So, sir, how do you ensure that the correct sperm is going to fertilize the best quality eggs?
We have something called grading of sperms. That is what is all about. Like the head should be this much size. Normally, sperm looks like a worm, so that has a categories. Like the head should be this much size, the mid piece should be this much size, the tail should be this much elongated, the neck piece should not be either thick or thin, that should be moderate. The head should not have vacuoles more than one. Vacuoles is something like you will see some bubble kind of thing inside the head. So all those if we avoid, that is the criteria that we follow. That is the international criteria as per the WHO.
So, sir, in the earlier previous years, the embryology and these techniques in IVF process are very low. But recently they got too advanced. And what are the future advancements you are looking forward?
So the latest advancement what we have in town is called AI. So what actually it does is it removes the barrier of a human limitation. Where actually what it does is it takes it has a huge data set with it, that it predicts that this embryo, this growth rate, this size of cells and everything can lead into a better pregnancy. This research is still underway, that there are many AI tools that is being employed to select the best embryos, and there is something called time lapse. With time lapse and AI combined, that is where the advancement is coming. There is something called pod babies also, that the baby is grown outside the body. It is just a concept. It is also being underway.
So, what are the equipment you use in the IVF labs, or like anti-vibration table, and what are the incubators and microscopes you use?
We have all the microscope that is being in the market. So we have something called RI micromanipulator. We have something called Nershige micromanipulator. We have something called Nershige Technome. So these are we have at 49. And also, as you have talked about incubators, we have the world class incubator, that is G185 and G210, that is K system. This is the model number. So it has a multiple chambers which is designated for only that patient for the whole 5 days. So with that, we are not disturbing that embryo during its growth process. By in terms of this anti-vibration table, since we have discussed regarding that, is very tiny, right? So even our breath or any vibration in the atmosphere will we will not be able to hold that oocyte or the sperm precisely. There will always be a vibration under the microscope. So to avoid that, any vibration which is from the external places, we have something called very delicate table which is having the suspension and everything, which stables the gyroscopic method. So it stables at certain position that the handling of gamete should not be affected. That is what anti-vibration table is all about.